Aloha, this is Everyday Wellness, and I am Dr. Eliza Kim. Today we're joined by Dr. Kristen Coles, a naturopathic physician and an acupuncturist, and we'll be discussing on natural immune support for children. Welcome.
Thank you. Thanks for having me.
Thank you so much for coming. Well, I wanted to speak to you today about how the development, how the immune system is developed in children, and how this will affect us and as we grow older.
Yeah, anyone who has children or who has spent any time around children knows that the childhood years from, birth to around age 5 to 6 is years that are full of lots of immune ups and downs. Right. And part of that actually reflects the natural development of the immune system. So we can talk in the beginning about what occurs in everybody. What's the normal progression of the immune system? And as humans, we actually have 3 different arms of the immune system. We have an innate immune system, we have an adaptive immune system, and we have a passive immune system. And we'll talk a little bit about those 3 to begin with how the immune system normally forms. So the innate immune system is what we're born with. And from the second we exit the birth canal, we are inoculated with our innate immune system. And the innate immune system covers our skin, it covers our nose, our throat, our mucous membranes, all the way down our entire digestive tract. And we get this immune system in utero. So the mother's immune system shares her immune system with the baby's, and they have shared blood supply, and the baby gets a lot of that from the mom. Then additionally, when the baby exits the birth canal, the baby gets a huge dose of bacteria. And these are the naturally occurring good bacteria that line the vaginal canal. And that bacteria gets in the nose, it gets in the mouth, the baby swallow it, it gets in the eyes, and it gets all over the skin. And that actually plays a huge role, a critical role, I would actually say, in helping a baby's very beginnings of the immune system.
So how does this affect babies who are, who had C-section rather than vaginal birth?
That's a great question, and one of the questions that I'm always asking any of my parents who come in with pediatrics is, was it a vaginal delivery or was it cesarean delivery? Because it does actually make a huge difference in their progression of their immune system later in life. And many babies are born by C-section, and that's a very common practice nowadays. And there's nothing inherently dangerous about a different C-section versus vaginal in terms of the immune system formation, but there are interesting studies that do show a difference in the formation of the immune system and the formation of our gut, actually, between C-section and vaginal. So if I have a child who comes in who was born via C-section, I recommend that we do a few simple steps to just sort of boost that bacteria that should have been inoculated for them. And we can do that in a couple different ways. Doing some probiotics is a very useful way because that will actually help give them that beneficial bacteria that they may have not had going through a C-section.
That makes a lot of sense.
Yeah. So the innate immune system kind of begins that way. And then we have something called the passive immune system. And the passive immune system is what we get passively. So the best example is that babies, when they are breastfed, they get many immune markers from that breast milk. And the mother, again, shares her immune system with the child. Antibodies are actually delivered via the breast milk, and a number of different immune cells will come into the body through the breast milk. And that's sort of a passive way that we get immunity. Breastfeeding is, I think, a crucial and critical part to developing the immune system in early childhood.
I always tell my patients, if before they start to have children, during their planning process, they should take minimum 6 months, if not, good 2 years to prepare themselves to, carry this child, because of, boosting up the immune system as a mother. I mean, it's such an, critical thing. And not only that, the digestive part of it, because many of the mothers, they don't have the digestive good enough digestion to pass on to their children. And then, we have this in Chinese medicine, the kidney energy is really, really important.
Yes.
And if you don't have that, good part from the parents, then the children will born with a weaker deficiency in those organs.
Yes, absolutely. I often have women coming in and saying, well, we want to have children, we want to plan for that. What would be the timeline? And, in a perfect world scenario, 1 to 2 years.
Right, exactly.
For planning, doing specific things like looking at things like heavy metals,
Sure.
other things that can impact the immune system and can get transferred in utero.
Right.
But absolutely, just making sure that the mother is healthy enough and has a strong immune system and has, plenty of nutrients to make her way through the pregnancy. But then, it doesn't stop after birth.
Right.
Then we have to have enough resources and enough nutrients and enough energy to actually produce breast milk.
And how many mothers, go through stress during their pregnancy or even during the pregnancy which is a critical time. I find many women to either they're moving, remodeling, they're going through different jobs, or they're working more because they won't be working so much once they had the baby. There's just so many different stressors. And how would that affect the whole immune system?
Stress is an effector of the immune system, absolutely. Right. What I counsel a lot of women who come in who are, mid-pregnancy or pre-pregnancy is that we have stress all the time. Stress is a very natural thing, and stress always upticks during pregnancy. It's just a fact of pregnancy, unless maybe it's your 3rd or 4th pregnancy and you're, you are a pro at it at this point. But that first pregnancy, stress is always going to take a little bit of a tick up. And a lot of times I'll recommend acupuncture.
Oh,
I
good.
love acupuncture for the prenatal time period. Reason being is that the mom really doesn't have to do anything. She just has to show up. She just has to relax, and we let the needles do the work.
Exactly.
And massage or yoga or anything that's kind of a self-care is great for moms to be. And, I always tell them, if you're someone who is already high stress before you go into pregnancy, we can probably guarantee that you're going to get a little more stressed.
Wow.
So let's put things into play beforehand to help with that stress. And what I don't want people to do is start getting more stressed because they're stressed and they can't, and they're worried about their worrying affecting the baby. And I just tell them stress is a normal thing, and as long as we can kind of keep control of it and do a few things in your everyday life to minimize it, I think you're going to be okay. Yeah.
That's a great suggestion. And I did get acupuncture personally, every 2 weeks. I was very religious about it. I had my chiropractic care and my massage and everything. And I have to tell you, I had one of the best pregnancies you can possibly imagine.
Yes.
It was a lot of joy to be pregnant and had more energy than, you could ever ask for.
Yeah.
So, I would hope that many women can experience the same thing rather than, the pregnancy being the miserable time of the,
Absolutely.
of the year.
Exactly. That's what I love to hear. I love to hear that people say, you know what, I loved being pregnant, because it's a very important time for women, and it shouldn't have to be 9 months of suffering.
Right, exactly. And you should feel nourished. This is one thing that I've noticed, you need to feel nourished when you are pregnant rather than feeling like, something is being taken away from you, because, you hear a lot about the nutrients being taken away by the baby, and that's not quite true if you are doing things for yourself.
Yeah, absolutely. In Chinese medicine, because I'm also an acupuncturist, in Chinese medicine they talk a lot about the blood, and the blood is something that we want to definitely nourish and boost during pregnancy and post-pregnancy. The breast milk that we were discussing is actually a outpouring of how strong the blood is, and that's our nutrient density. So, you know, breastfeeding, we need an additional 800 calories or more every single day on top of what you should already be eating in your maybe 2,000 calorie a day diet. It takes a lot of calories and a lot of nutrients to form that delicious, nutritious breast milk for your baby.
Very true, very true. And not to be just doing, you know, grabbing things, you know, rush just so you're eating. And what we tend to do is sometimes we make bad choices on food, you know, filled with carbs and things that are really definitely not nutritious. But I think that needs to continue on not only when you're pregnant, but also, you know, when you're breastfeeding and after.
Yeah.
Right.
Absolutely.
Right. So
yeah, so the passive immune system is what we gain via our mothers, via the breast milk. That's the biggest example. So, you know, the innate and the passive immune system really help form our immune system.
Great.
Then we have the adaptive immune system.
Okay.
The adaptive immune system is sort of the biggest arm of our immune system. And this, because of this immune system, is why we often see the kids with the sniffles every other month and lots of colds, lots of infections, lots of spreading the germs between, you know, child to child. That's because the immune system, while it's been formed via the innate and the passive, it has not been inoculated to the regular bacteria, the regular viruses, the regular fungus that as an adult we've already seen lots of.
Right.
And it's very important actually for your children to get those little colds.
Right.
It's teaching their immune system how to respond to viruses, how to respond to bacteria, and once the immune system has seen a certain virus, a certain bacteria, it should learn. It should adapt.
Interesting.
And learn that that particular cold or flu that it has seen, so that in the future, when it sees it again, you might not even mount much of an immune response, or you will mount it so quickly that you won't actually get the symptoms or the sickness because your immune system has already seen it.
Right, exactly. But then, you know, I mean, that would be the ideal scenario. But what about the children who continue to get sick, you know, month after month after month? I mean, you see that a lot, where they have continuous, like, runny nose or, you know, cough.
Chronic ear infections every other month, chronic sinus congestion, chronic coughs. That's actually an abnormal immune response. And that is what lands many of my young pediatric children in my office because, you know, parents aren't sure what to do. They have a sense that their kids shouldn't be sick every month. And there's not a lot of options other than, you know, antibiotics on the conventional side of things. And, you know, a lot of parents don't want to give antibiotics month after month for good reason. So then they end up with me and we have a discussion about what is a normal immune response and what isn't. And we need to go through all those variables. What did their prenatal time look like? What was their, you know, birth story, vaginal, cesarean section? What was their history of breast milk, or did they do a lot of formula? If they did formula, what types? All of these things that we just talked about play into that adaptive immune system. And what we know is that if a kid is getting sick month after month after month, their immune system, that adaptive arm, is not learning how it should. It's seeing a virus, it's getting very sick from it, and then it's seeing it again because viruses can, you know, replicate, change a little bit. We can get sick with them again a few weeks later, and if the immune system hasn't learned, it will continue to get sick. And that usually has to do with a lot of different things. And I will look into diet, and I will look into all those things we discussed and make changes accordingly. And often little changes in diet, some of the foods that they might be eating could be impacting and lowering their immune strength, and maybe doing a few easy immune support treatments, some of those being things like probiotics. Probiotics are an amazing way to boost the immune system actually, because 60 to 70% of our entire immune system lives just beyond our gut walls. So that digestive health and the microbes and bacteria inside our gut that we get when we're born are very, very important to our immune response.
And probiotics are easy for children to take because they have really no taste to them, and so I think that's very critical.
Yeah.
And a lot of these information about the diet we had covered in our last show. So when our viewers go back to our last shows, they can get the information about the diet part of it. So we won't be covering so much of it this time, but I would like to know what maybe the cause and the trigger, of the child getting sick over and over again, other than the dietary part of it. Like for example, like the environmental part of that.
Absolutely. There's things like allergies. Here in Hawaii, we get a lot of the VOG. We get a lot of allergies year-round from all the flowering plants and our mangoes and all of those great things, but they put a lot of pollen into the air. And one thing that we know is that with that passive immunity that mothers give to their babies, if a mom has a lot of allergies, we might see that with baby.
Yeah.
And so allergies are a huge contributing factor to things like sinus congestion that continually there, postnasal drip, cough. So the environmental factor is huge. Dust mites is a really big trigger for some people who are more allergic. But again, when we see these allergies that are kind of going into high speed, we can look again at the gut, because again, it goes back to gut health. So there's a lot to talk about with the gut, which we did cover, and definitely please go back and look into that episode. Then of course there's other things like vitamin D levels. Vitamin D is a hormone, actually. You might have heard of it, and it is very important for the immune system. It's very important for a number of other things, but the immune system and vitamin D are very closely tied. And sometimes I will check vitamin D levels on my pediatric patients. I often check it in my adult patients. And even here in Hawaii, we often have low levels of vitamin D. You might have heard that vitamin D, we get it from the sun. And yes, that's true, but we don't get it if we're covered in sunscreen and clothing.
And if they don't metabolize it.
Exactly.
If they can't convert that, then you will be deficient in vitamin D.
Yeah, there's genetic issue called a VDR TAC. It's a vitamin D receptor mutation. So we actually have mutations on that receptor site for vitamin D, so we won't get the vitamin D and transport it into our bodies and turn it into the hormone that we need. And that's actually very common. So there's a lot of things we can look at with vitamin D. Sometimes I will put children on a small dose, 1,000 IUs of vitamin D every day, especially during cold and flu season, and that can make a big difference.
Interesting. Okay, great. And what, as far as like, one of the things I was wondering is, what is the difference between the bacterial infection and a viral infection, and how does this, why, this difference make a, why does it matter?
Yeah, that is a great question. And the biggest reason of why it matters is because a bacterial infection, we would use antibiotics if we wanted to, but a viral infection, using an antibiotic will do nothing. Now, the majority of colds and ear infections and sinus issues and coughs that very young children get, 90% of them are viral in nature. However, most of our children, when they're taken in for colds, ear infections, coughs, sinus issues, they're given an antibiotic. This has led, unfortunately, to an issue of antibiotic resistance in the human population. And I, over and over, try to stress to all of my parents that if it's bacterial, yes, an antibiotic will work and might be very necessary. But if it's 90% of the time a viral infection, don't take the antibiotic. It's going to cause a detriment in your child's system. It's going to cause a detriment in, our entire population of causing this antibiotic resistance that we're seeing. That's such an issue. And how do we know the difference between a bacterial and viral? Bacterial infections often come on very quickly, and they will mount a very high fever, extremely high fever. And the symptoms, let's say it's a sinus, the symptoms will be tons of mucus.
Okay.
It will often be green colored.
Right.
If it's an ear infection, there will be when I look in the ears, there will be a huge amount of fluid. There will be a lot of mucus behind that membrane.
Right.
It looks very different than a viral infection, which viral infections they still have fever. It's more low grade. The mucus and secretions will still be there, but they might not be as thick or purulent.
Right.
They will be possibly lighter in color, maybe yellow, and fevers won't spike as high. Often with viruses, we'll also get digestive upset with it. That's very common, that we'll get like a cold and maybe a